The new McMaster NICU Pigtail Chest Tube Insertion Guideline. Equipment required for the Furman Pigtail Chest Tube Catheter Insertion. Please set up the patient for a sterile procedure as we typically would in the NICU. Use antiseptic skin preparation in the form of chlorhexidine applicators. When you are completed with the procedure, please wash off the chlorhexidine with sterile water to prevent skin burns. You will need sterile trach gauze, sterile water, a 10 ml syringe, fentanyl for procedural pain as per unit dosing guideline, Furman pleural/pericardial drainage set, advanced tegaderm, Heimlich one-way flutter valve or the Pleurovac, steri-strips, and a sterile measuring tape. Preparation of supplies and patient. Number 1, fill a 10 ml syringe with sterile water of approximately 3 ml. Number 2, for babies greater than 1 kilo, measure 2 centimeters from the end of the curvature on an 8.5 French Furman catheter and place the steri-strip to mark the location. For babies less than or equal to 1 kilo, use the third marking from the last drainage hole on a 6 French catheter. Device insertion. Step 1. Cleanse the lateral chest wall with antiseptic in the form of chlorhexidine applicators and wash the area with sterile water immediately afterwards. Step 2. Drape the surgical area, leaving a small opening at the site for insertion. Leave the head and neck region visible. Step 3. Landmark for device insertion. Use the 4th to the 5th intercostal space in the mid-axillary line. Step 4. Take the 10 ml syringe with sterile water added. Direct the tip of the needle in the direction of desired catheter placement, over the top of the rib and below the intercostal artery and vein which lie at the inferior margin of the rib above. Step 5. Gently advance the needle while aspirating into the positive pressure area. The depth of insertion should be no more than 2 centimeters. Step 6. Aspirate air or fluid into the syringe. Remove the syringe once placement in the pleural space is verified with air bubbles appearing in the syringe, in the case of a pneumothorax, and occlude immediately with your thumb. Step 7. Introduce the guide wire and gently advance it into the cavity. Of note, the guide wire should advance without resistance. Insert the guide wire until the silver mark of the guide wire reaches the pink hub of the needle. Step 8. Remove the needle, leaving the guide wire in place. Remember to always stabilize the base of the guide wire once it is in situ. Step 9. Thread the dilator over the guide wire to the level of the skin and soft tissue and carefully twist the dilator to dilate the skin, muscles, and pleura. Step 10. Remove the dilator, leaving the guide wire in place. Step 11. Thread the chest tube over the guide wire and advance the chest tube into position to the steri-strip marking on an 8.5 French catheter or to the third marking on a 6 French catheter. Remove the guide wire and attach a 3-way stopcock followed by the multi-purpose Christmas tree adapter to the chest tube catheter. Connect to the Pleurovac or the Heimlich valve and observe for bubbling in the Pleurovac or fluttering of the Heimlich valve. Step 14. Place advanced tegaderms over the catheter at the insertion site and place trach gauze underneath the catheter. No suturing is required. And step 15, remove wet drapes and lines that may potentially be soaked with antiseptic technique to avoid skin burns.